see her.
It is 5:30. I'll call our meeting to order. We'll start with a committee meeting. And Mr. Haskey, I will turn it over to you if you're ready.
So we are going to consider approval of budget amendment. My agenda says.
Ms. Harris was coming right back.
You could go ahead and present this.
I could, but we want it to be right.
Let's say Justin present it.
I'll say just say yes. Let's just say yes. Let's just do it.
No, there's a reason he's the committee chair.
That's why Justin doesn't let me control the money. Because I'm like, yeah, just do it. Afternoon,
Morning.
whatever.
It's been a very long day.
It has started at 6 this morning.
What are we going over first? The budget amendment?
It looks like the budget amendments.
So what I did is I went through all of the outstanding POs for items that were encumbered last year that the money didn't get spent. So that's what a good majority of these are. If you'll look at them, they'll say carry over prior year encumbrance. Sometimes, a lot of times there's a PO associated with it. And so I went through all of that. So that's the good majority of these, just to carry over money that wasn't spent. A lot of it is in our capital projects line items. And then the other things that we added was our public safety incentives that y'all approved a couple months ago. And then also the mid-year salary increases. We also added those. There was a few other things in here as far as not related to projects. So I went ahead and included the $1 million for the commitment on the combined dispatch. We had it in the restricted fund balance, but so we went ahead and added that into the budget because it looks like we're getting closer to having to start spending some of that money. We also had a situation where we discovered that a lot of our AEDs, the defibrillators, the batteries had run down on them. We were not able to get replacement batteries, and so we had to replace 11 of those throughout the city for a health and safety issue. That was about almost $25,000, and I believe y'all might have approved that purchase. I cannot remember. At our MSC, we had some unexpected lift station repairs. So we have a private lift station on our MSC building. And so that came up at the very beginning of the year in October. It's about $12,490, which totally blew the budget for the repairs, building repairs at the MSC. So we included that in. It was an emergency repair. We did not anticipate that to happen. We carried over on the brick streets an encumbrance related to the, I guess, the engineering of some of that. And then in our wastewater treatment plant, on our contract for our operating services, we had just budgeted the same as last year, but there was actually an increase of about $52,000. And then we also included for the inclusive playground, we had received some donations this year, Waste Connections, Keep Stephenville Beautiful, and in order to be able to spend those, we which we don't budget for those type of donations, so we've included those in, and then also the expenditure so that Darren can get some of the pre-work done for the phase 2. So all of that added together in all your different funds has and added about $3 million to the budget. The thing is a good chunk of that was savings from the prior year, so it wasn't spent, so we're adding it in.
About how much of that is from prior year?
Probably all but about 900,000, because you had the 600,000 for the salaries, another 100,000 for the public safety, and then a few other odds and ends on top of that. So really all but the majority of it, at least $2 million, was stuff that wasn't spent last year.
And then the salaries are just moving it from the streets portion of the budget.
We didn't actually have to do that. this time because
So
we,
there's
because we
900.
had some,
So
because
there's-
we had some savings, from last year that was actually able to cover the salaries, because we were talking about 600,000, but half of it, because it's gonna become effective in the middle of the fiscal year. So it's about 300,000. So we had enough savings from last year to actually cover that for this year.
Are there any questions of the committee?
So, you said the defib machines were, I mean, it says here it was council adopted, so I assume it was in the budget, but you can't just replace the batteries, you have to buy new equipment, is that where we are with that?
Is there anybody from fire here that can help me with this?
Some of those were additional units. When the fire department kind of did an audit of the equipment, some of it's replacement, and they needed to be completely updated and replaced, and then some are additional where we didn't have them and felt like probably sooner rather than later, we needed to go ahead and get that done.
Okay.
How much of the 3 million is related to the general fund budget?
It's on the back of this. 2.1. I want to say all but about 400,000 of that is carryovers. $450. You'd have your salaries, and then the defibrillators, I think, was the only one on it.
What's the current unencumbered balance of the general fund?
So we ended the year with better than we anticipated. So after these adjustments, the unrestricted in the general fund would be about 4.3.
Does that 4.3 include the reserve requirement for 3 months?
Yes. Yes, it does.
And what is that number, 3 months again?
I'm sorry.
How much is that, what is that 3 month number?
It's about 4.6 million.
What's the pleasure of the committee?
Mr. Chairman, I move that we forward to council with a positive recommendation, the budget adjustments as presented.
Second.
A motion, a second, any discussion? All right, all those in favor say aye.
Aye.
And opposed? Motion passes. We'll go forward to council with a positive recommendation. That's all I've got on my agenda. Mayor?
Mr. Clinton, you're gonna pull your item?
Mr. Mayor, we are gonna pull that item. If it need be, we will bring it back at a later date.
Thank you, sir. Ms. Durfee?
Thank you, Mayor. We have, actually, Mr. Brown is gonna come up and do a presentation for us.
Thank you, Council. Durfee. Mayor, Council, Administrative Services, which oversees tourism, or what's slowly changing as the name of Destination Marketing, has received the Texas Hotel Lodging Performance Report for 2023. Michaela, our tourism manager, y'all have met, along with the recommendation of our city manager, thought it would be good to bring this information to you. So what you have in front of you is a performance chart of the cities that we have self-selected to compare the lodging activity to. And this information is provided to us from the Texas Hotel Performance Fact book called Source Strategies. And so you have that chart in front of you, and just look at the top line, talks to you about Stephenville's performance, which we have a room count of 493, 365 days that we know is in the period, the total available rooms, that number there, and then if we were 100% occupied, the fair market share rate for us would be around 15.42%. That would put us in fourth, as you can tell, of those that are listed there. But the Source Strategies estimated occupied rooms says that we're around 60%, which would be second of those rooms. So looking at the estimated rooms sold for that year was 108 plus, and then the fair market share would be at 16% of that. And we just thought this information would be good to show you and tell you that the activity going forth with people using our lodging facilities here in Stephenville is good. And we're kind of excited about this information and hope that we will continue to bring information of this sort to you, just so that you can have this information. And visiting with the mayor and the city manager and Ms. Durfee, they want us to make sure we're bringing this information in front, as well as some information on our main street. And so we'll be doing this as time allows. We did take a look at, just so you'll know, at hotels just west of us for their available rooms, but their rooms and numbers were considerably less. And so we didn't want to include them in on this report for you. So that concludes my report for you today as it relates to our Stephenville lodging performance.
Does anybody have any questions?
Have you had a chance, Daryl, to look at that report, the study that we helped pay for a report when Tarleton was doing their hotel study? And it's been 4 years or so, and I think about 18 months ago, they renewed that in the last go-around for bids, RFPs for building the hotel there, about how much the need for hotel space is in town. Have you had a chance to look at that?
No, sir, I haven't.
I'd probably get a hold of Lori Beatty or someone out there and
Okay.
get a copy of both of those. Well, one of them, we should have one.
I was informed they're fixing to update that.
There's going to update again, okay.
Okay. Thank you.
So the one that they did just for this last go-around is going to be updated again?
Well, she said that they used the one we did in 2019.
Okay, okay,
And so they're going to update it one more time.
okay.
Thank you.
Thank you, dear. And I don't have anything else.
Thank you, ma'am. With that, we're going to conclude at 5:43 our committee meetings, and we're going to convene into our special city council meeting. I'm going to call it to order at 5:43. And with that, I'm going to also then recess us from the committee meeting into the Employee Benefits Trust meeting and turn it over to, okay, Jason.
All right, Mr. Mayor, council, it's that time of year where we need to look at renewing our health insurance plans that we do for our employees. And so I've asked Mr. Rodney Dryden from HUB, who helps us with this process, to be here to kind of help answer questions. And so before you, I've provided a bunch of information for you. One is a kind of a demographic analysis of our workforce, and I'll kind of let you guys look through that at your leisure. But it has some great information on kind of our demographics here at the city of Stephenville. Another set of sheets that you have is from First Stop Health. If you remember last year, we made a switch in our telehealth provider and went with First Stop Health. And so this provides kind of utilization for it. One of the unique things that First Stop Health provided was a virtual primary care physician option in addition to the kind of urgent care that you can get. And so you'll see kind of how it's performed and being utilized. And so we kind of continue to see a rise there. This past year, we've been with United Health, had an HSA plan. When we went to market to receive bids, we were at 106% in received benefit versus what we had paid. And so that made it a little tough when Rodney and his folks kind of went out to market. And so United Health basically pitched us a 25% increase on our behalf. Rodney said no thanks and began looking at different options. And so if you kind of look at the sheet that I've handed to you that has different plans, on the far right-hand side, you'll see these ones under the yellow banner. And so those are Blue Cross plans. And so those are kind of going to be my recommendations to council. And so the ones under the banner, the one on the left is an HSA plan, kind of like we currently have with United Health. You do see a change in the deductible from $3,000 to $5,000, but you also see a change in the total out of pocket, where currently that is $6,350. It will come down to $5,000 with the Blue Cross plan. It will still have the maintenance drug program that we've had with Blue Cross before and with United. The total cost increase on that per employee is about 5.69%, from $415.87 to $424.37. If you remember from our budget this year, we had recommended and y'all approved in the budget for $1,500 per employee that's on the plan for HSA contribution. We believe we can still meet all that, and so we're asking for that as well. And so the $424.37 and then $1,500 breaks down to $125 a month. That becomes kind of a per employee per month cost of $549.37. The plan to the right is something I'm asking us to consider this year, is to provide an option for a more traditional PPO copay plan. If somebody thought that was better for their particular situation. And so if you use the $549.37 as the per employee per month cost that we're spending on the HSA, it more than adequately covers the $487 that the premium would cost under that PPO plan. So again, we're kind of recommending both of those. Where we really kind of took a hit on the rates as they came back was kind of down at the bottom on the dependent coverage. An employee that covers their spouse, currently there's 5. That actually went down a little. Currently it's $607.77 a month, and that would go down to $551.16 under the HSA plan. So it would actually be a drop. But an employee that covers children only, and there's 14 of those, is going from $317.53 to $500.82. A family is going from $925.04 to $1,051.98. So looking at dollars and money that we've saved this year, it's my recommendation, and I'm asking you guys if you'll fund an additional roughly $40,000 to subsidize that increase for the folks that choose children or family to help offset that difference. And then if you want onto the PPO plan, anything additional would be on you. For children under that plan, it would be an additional on you $12.87 a month. I think under the family plan, it'd be $95. But so I'm asking you to subsidize the difference in cost on the HSA plan. And then if you want the PPO plan, then that would kind of be your cost in addition. Rodney, did I miss anything factually on?
You did a fantastic job.
Okay.
Why don't you come up here so that we're recording that, so we'll have you on, so the employees can see.
And so Rodney, if you have specific questions about how the plans work or how the process went, Rodney can have some of that information.
Mayor, Council, thank you for having me. Jason, Monica, thank you for your work. Jason laid it out pretty clearly. Over the last 4 years since we began working with the city, we've seen our overall cost on average decrease about 4.5% on average per year, while keeping benefits the same. This year, although the deductible increases from 3 to 5, as Jason pointed out, the out-of-pocket is $1,350 less. So a single person, if they do choose the HSA, their net out-of-pocket in a calendar year is $3,500. So it's a nice option compared to what they have now, because their net out-of-pocket now is $5,000 because it's $6,350 out-of-pocket. So it's a nice program. So I think that is a solid recommendation, and there were several things that went into consideration when contemplating that second option. Utilization, how your plan's being utilized, and you have some people that are reaching an age where they can no longer receive Medicare or HSA contributions because of IRS rules and Medicare eligibility, so having that there. The inadvertent effect of this is if an employee selects that copay plan, the city saves a few dollars. It's just the way the numbers work. So it's not a force, it's an option for those who think that program would work best for them. So over the same period of time, Jason and Monica and I talked about claims. In the last 4 years, our claims, in 2021, at the time the renewal was issued, our loss ratio was 50%. In 22, it was 63%. In 23, it was almost 91%. And one correction to something Jason said, at time of renewal this year, plus 2 weeks, our loss ratio increased to 116%. So they paid out 16% more than they took in, United Healthcare did, over the last 8 months. So we have to be cognizant of that. We pulled some data and some of the metrics we evaluated. You had 126 claimants, employees, dependents, what have you. Of those, 88 of the 126 incurred less than $1,000 of expenses. So your people are not abusing the plan. Your people have learned to use their health care, and they're using First Stop as a great tool. We've seen people that have used that First Stop program, the virtual PCP, that on the exit survey asked, when was the last time you saw a healthcare provider? And a lot of them couldn't remember, and this was their first. So that program is being utilized the way that it should be. So, and it's keeping those claim dollars off of our risk, which is also a secondary purpose of the program. So all of those things are going the way that they should. Having options is good, and in this market segment with Blue Cross, to have the second plan, there is no load, as we call it, or an additional cost for that. We asked United to offer a second plan. They said, yes, we will, 2% more. And I think you saw the graphic. It's 25% increase for current plans, and they wouldn't budge. So, Jason, have I missed, Monica, have I missed anything?
Yes, the last information he was giving y'all should have that sheet as well that kind of lists kind of that number of claims information and how that went.
And to your staff's credit, Jason and Monica both, they have spent a lot of time on the metrics and the data analytics of our claim makeup and how it goes, not specific to anyone, but just data and how our plans are being utilized. So Blue Cross has come in with a nice offer, and it's disappointing, of course, that it's not a flat cost, but it's better than it could have been. And for those of you who are in buying positions where you work, our targeted loss ratio is around 78%, and we're at 116. So market did what we needed it to, but we need to be mindful of that in 12 months. We watch this monthly So we've already had the discussion about 2025 and projecting and those types of things, so we just need to be aware. If we continue this trend of utilization, next year could be tough.
On the other plans beyond the health insurance, so the packet that had this chart on the next page, so to get Blue Cross down, we recommended bundling all the different other plans as Blue Cross as well to bring that percentage down. And so on the dental, kind of the standard to what we had been, that looked exactly like what Guardian had, was about $22.02 per employee over the 1915. But Blue Cross pitched us instead of up to 1,000 coverage, 1,500 in coverage for a nickel more. So 2202 to 2207. So we've recommended the 1,500 in the max coverage. Vision is all on the employee if they choose. We'll recommend moving that to Blue Cross as well. And then the basic life accidental death and dismemberment well, we provide the basic life. And so we'll move that from Mutual of Omaha over to Blue Cross. It's exact same plan, exact same cost. It does include some counseling that wasn't previously on the other plan, but we also have several other counseling options that we pay for. And then the voluntary one would move over as well as the voluntary short and long-term disability plans. And
Questions?
Any questions?
So I've got two, Jason. One, if multiple plans are offered, what kind of training would be provided for the employees to make sure that they're actually picking the best insurance plan for them and their families? How would y'all handle that?
So, first thing that'll happen, if we approve this tonight, then Cheryl Truss and I are immediately gonna start going around and scheduling meetings with all the different groups of employees so that we let them know what all the plans are gonna look like, and we'll start providing them this information. Rodney and his staff, and that's the reason we needed to get this done tonight, so we'll do open enrollment mid-April, probably?
Probably before that.
Probably before mid-April. And so during that week, him and his folks will be available here for employees to ask questions, all those kind of things. But well prior to that, they'll be armed with physical information in a meeting with Cheryl and I. And then they can start looking at, we've already had them download drug lists that'll be different from one plan to the other. So they'll have all of that information to start looking at ahead of time, so they can talk with their families or whoever they need to talk to about what direction may be best for them.
In our benefit admin tool where folks can go in and make their enrollment elections, they'll have the ability to compare what they have now to what their options are for '24. And we'll have folks there that can explain the differences in those programs, how they work, and basically counsel someone based on if they want to share their own unique needs to make sure that they're making a good choice in their buying decision. So those resources will be available to your folks, and we'll be sure and explain each program and how it works and how it impacts them. And for many people, it comes down to, especially those, I think, 22 or 3 people that covered dependents of some level, it's about cost. And so it's really those single employees, when I say single, they're only covering themselves, that'll take the most education about making a good plan choice.
Second one, you mentioned a subsidy for the families and children. Where's that money from?
Yes, sir. Right now, that'll be coming from insurance savings from this year. So, kind of Rodney's numbers, he builds his numbers based on the 142 plan participants. Budget-wise, we plan for the number of budgeted positions in the city. And so this year, that was about $1.2 million. Because of vacancies, we're a little over $100,000 ahead. And so we're planning on utilizing those funds to cover that.
Okay, thank you.
Anybody else?
If you're, and will that subsidy be specific to children only?
Well, children and family, the spousal, the cost is actually
Right.
going down.
Right, but, so you only get the subsidy if you participate in those plans?
Yes, sir.
That's the way that the plan policy, the city can do it that way?
Yes, sir. We've done it before. I think the last time we probably were doing it was about 5 years ago.
Not discriminatory, because we talked about the HSA going towards premiums if they chose a different plan, if they didn't do the HSA.
I think what we're doing in this scenario, specifically on the employee level, is we're creating a defined contribution, and we're saying you have X dollars as an employee to choose. If you choose the HSA plan as a single person, that will cover your premium and provide for a $1,500 deposit into your health savings account. If you select the copay PPO plan, which again is your choice, like I said earlier, the city will net save $45 per enrolled on the single level.
Right.
The employee and spouse coverage on the high deductible health plan, or HSA, actually went down for those 4 people or 5 people that are currently enrolled with spousal coverage. So I think, Jason and Monica, what the goal here was to, for those 18 people who are covering children or family, is to not have them see a significant increase. So we would create a defined contribution at the employee level, at the employee spouse level, and at employee and child, and the employee family level, setting that cost. Those dollars would be equal for anyone that elects to choose those options. If they choose not to, that's their choice. So it's really non-discriminatory. It's available to whomever is interested in those options, but again, it is a choice.
Okay.
And again, that'll be clearly identified during the enrollment process, so
Yes, sir.
everybody-
We'll build a chart, basically, that shows what their costs are. And when they log into Employee Navigator, which is our online tool, they'll be able to see what they're paying today and what the costs are going forward. But we will have a paragraph to give the city credit for the additional contribution to make, for lack of a better phrase, to make them whole for the coming year.
What would be the proposed cost, a budgeted number for this then?
For the subsidy?
No, for the plan, because we normally talk around, we have $1 million. What is the number now with all in?
And so Monica's got that built. Now that's gonna include the helicopters and all the other things we do. Miss Monica?
It's about 1.3.
Over versus,
1.212, so it went from 1,212,000 to 1,305,000. And then we also get another $25,000 credit on top of that, so. The annual increase for budget was 93,000, and then Blue Cross Blue Shield is giving us a one-time credit on our second invoice, so the net increase for budget would be 68,000.
Okay.
And we have the savings so far this year to cover that.
Okay. And the one, how much was it again? 1 million?
1,305,000.
Okay. And that would be if every position was filled?
Yes, sir.
In the city? Okay.
So that's probably what you can look forward to when we work next year's budget is the number that we were looking at if we don't have any positions.
Perfect.
Anybody else? Several years ago, Monica, back previous management, we went to an HSA program, and you worked real hard on that. This plan would have been tremendously higher per employee had we not started the plan that we did and started educating, started the virtual kinds of options, et cetera. And so I think y'all have done a good job with this. I appreciate y'all's work on this a lot. With that, any other questions? Since we're in a public benefits trust meeting, do I hear a motion?
Mr. Mayor, I move that we forward to the full council positive recommendation to approve the insurance plans as presented.
Second.
Have a motion and a second. All in favor, say aye.
Aye.
Motion passes. With that, it's 6:05. Thank you for being here, and thank you for the work you've done, too.
Yes, thank you very much. We appreciate you very much.
Well, your help for staff has been tremendous compared to what we've had in the past, so I appreciate that.
Thank you for that. I'll be sure and share that.
Thank you. All right, we stand adjourned. We'll reconvene now at 6:05 into our special city council meeting to consider approval of an employee benefits, as we just discussed. So I have a motion.
Mr. Mayor, make the motion to approve the employee benefits plan for 2024-2025 as presented in the Employee Benefits Trust meeting.
I have a motion is second. All in favor, say aye. Aye. Motion passes. With that, it is now 6:05. We're going to convene into executive session in consultation, in section 551.071, in consultation with attorney to consult over the pending or contemplated litigation. We'll be back. 6:42 from executive session. There was no decision or action taken during the session that needs to be reported publicly. So with that in mind, it is 6:42, and we'll stand adjourned for the city council, special city council meeting.